thank you for coming in today. Some people may know you from Samia's videos, and you're coming in here today to help me study for my practical board exam, so I'm really grateful because you've passed it and you're so close to being a naturopathic doctor, and I really appreciate your time that you've and the knowledge that you shared with me and how I can prepare for that. So thank you so much.
Of course, I'm happy to be here.
I'm literally like a month away from writing the exam, so I'm extra nervous. Even doing this video is kind of nerve-wracking, but I'm glad you're here to help me just in case I forget anything or if I do something wrong. Please correct me.
Of course, yeah, I'm here to support you.
Okay, so before we begin, I'm going to, as what we're taught, I'm going to explain the procedure, obtain consent, and sanitize my hands. That's really important. So, is that okay with you?
Yeah.
Okay.
Yeah.
All right.
Sounds good.
Perfect. So, how this exam is going to take place, it's going to involve me having a look, and sometimes I may gently place my hands onto your face area. It's called an EENT exam, and E stands for the eyes, the ears, the nose, and the throat. And so that's the areas that we're going to examine today. The exam should take anywhere from 20 to 30 minutes. At any point, if you have a question, you can ask, you can stop the exam. If you feel discomfort, you can let me know. And you're always welcome to stop the exam at any time where you feel you need to.
Okay.
All right, perfect. So I'm just going to sanitize my hands first, and then we'll get started. Okay,
Sounds good.
perfect. Making sure that I'm very thorough with the sanitization. That's really important. The other thing to mention is that I've pre-sanitized my equipment prior to using them to make sure that they're disinfected. Okay. So now with new COVID procedures, I'm required to wear gloves and also sanitize those gloves as well. So I have them with me here. So I'm just going to put them on as well. I want to say congratulations for passing your exams and finishing everything. It's really a big accomplishment.
Thank you. It was a lot of work, but you just have to put away all the doubts and keep believing in yourself. So that's my tip for you.
Thank you. I really needed to hear that.
Yeah.
Because it's like literally just the last bit for me, and
Exactly.
it's like sometimes it's like you're walking into this tunnel and you never know when it's gonna end, and eventually you see that glimmer of light and you're like, I'm so close, but at the same time I'm so tired, and it's just, you know, one step more and I'm there. So thank you.
Yeah, and you're so close. And I believe in you.
Thank you, Angelica. So okay, so now that I've sanitized everything and I've obtained consent, I'm going to begin the examination with inspection of the eyes. So I'm just having a look into your eyes right now, which are gorgeous, by the way. I love how the light is shining onto your eyes. I'm taking a look at the pupil size to make sure that they're appropriate for the lighting condition that we are in. So right now it's a bit dark, so we'd expect the pupils to be more dilated, and that's what I'm seeing right now. And I'm also looking at the size of both to make sure that they're equal. Sometimes in certain conditions we see what is called anoscoria, which is one pupil is a different size from the other, which could be caused from many things, usually damage to the cranial nerve, the optic nerve, cranial nerve number 3, or we may see this in overdose of certain drugs. So I don't see that. I'm also looking at the pupil and its ring around it. Sometimes in certain conditions where we have too much copper deposits, we'll see that in Wilson's disease. I'm taking a look at the sclera to see that they're white, because in certain liver pathologies we'll see a yellowing of the sclera, which is the white portion, and that's called jaundice. So I don't see any of that. I don't see any crusting, buildup, or eczema, or any lesions around the eye area. The eyebrows are nicely well groomed. That's important for me to note and to ask, have you groomed your eyebrows? And the reason being is because thinning of the eyebrows can be a sign of certain thyroid conditions where we lose hair, such as in hypothyroidism, and that's not the case where I see over there. The other thing that I'm gonna ask is, am I able to place my hand onto your eye area so I can take a look at the conjunctiva? Okay, so I'm just gonna place them upwards, and if you could look down. Okay, and I'm gonna pull the lids down here, and if you could look up. Okay, so I actually see a little bit of pallor. Sometimes with people who have low iron, they have anemia, we see a more pale color of the eyelids, and we can confirm that through a blood test by checking the iron, the B12, total iron binding capacity, or TIBC, and that's how we'll be able to determine to see also what type of iron, if it's an iron deficiency anemia or some other causes. So those are just some signs that I'm looking for. We can also determine that by looking at the patient's lips. In this case, Angelica's wearing lip gloss, so it's very hard to kind of tell. And we can also look into her fingernails, because pallor will also show up. And it's consistent, because I do see a little bit of pallor here, if you've noticed. I'm not sure if you know, is it do you have some?
I have low iron levels.
Okay.
Yeah.
Okay, so
you're bang on that.
so that's incredible that, just by inspection we're able to tell so much about what the patient is experiencing. Of course, we always want to confirm the diagnosis with blood work, and then from there we can create a treatment plan that's appropriate for the patient. So that's the inspection piece. Did I leave anything out there? I think that's for the eyes.
That's pretty thorough. You made comments on the pupil. You could talk about the iris color.
All right.
If there's any signs of hemorrhage in the sclera. You mentioned anoscoria, which is great, as it's related to Horner syndrome. I think the optic nerve is cranial nerve 1, so I'm not sure if that's the one that might produce the difference in size of the pupil, but maybe oculomotor, maybe? I'm not sure.
I have to double check it as well, because I thought cranial nerve number 1 is olfactory.
Oh, sorry, optic nerve 2. Sorry. Cranial nerve 2.
Which is the optic nerve, and cranial nerve 3 is oculomotor.
Yes, that's
what
correct.
I meant. Yes, I think that's what I also meant, but I just screwed it up.
It's okay, I screwed it up with you.
So it's good that we're on the same page and we know which nerves we're talking about, and we can actually test those nerves right now with the handy dandy pen. We can do a what is called the H test, which will test the nerves that innervates the musculature of the eyes that are responsible for lateral and medial deviation, and looking up and looking down. And that's going to test some of those nerves, including the oculomotor. And then when we do the consolidation, moving the pen in and out, that's going to test for the pupil size, and also with the light, which is the accommodation, which is the optic nerve.
Yeah, the accommodation is the pupil size.
Okay, all right, so I hope I'm saying this all correctly. So we'll do the H test first, okay? So all you have to do is look ahead. Without moving your head in this way, I would like you to follow the pen with just your eyes to as far as you could, okay? So because we're here now, let's do the accommodation. So I'm just looking at the pupil size, and as I move in, the pupils, it becomes uncomfortable. It's constricting as we expect, and I'm coming out. Okay, good. So what I saw was constriction on approach, and when I pull back, then dilation, which is what we expect in this case. So I'm also gonna start moving the pen to different axes, and I'm gonna push to the point where it feels uncomfortable like you felt, but I'm not gonna do anything that's kind of torture. It just helps because sometimes when we move the eyes to the point of their maximal range of motion, we can see in some people, what is called a, I can't remember. Nystagmus.
Yeah.
Yes, a nystagmus. So that's what we would be testing for. So I'm now going to move to the lateral and medial deviation, and I'm going to go up. That's the external oblique here, lateral rectus, and then down, and then back here, coming back to center, and moving to the side, and up, and down. Alright, so we're testing the range of motion of the eye that we can kind of see where its maximal end range is. And coming back. Okay, so what I'm noticing is equal movements, so not one is ahead of the other. And I also didn't notice any nystagmus. I didn't notice any twitching of the eye, and I can ask the patient how that went for them. How did that exam go?
It was comfortable.
Okay, so we didn't notice any abnormal findings in this case. Okay, so that's part of the inspection piece. The other thing we can do is test again the accommodation to light using an ophthalmoscope. Okay, so I'm just going to handy dandy tools. Alright, so this is an ophthalmoscope. It produces a light, as you can kind of see, and this is what we're going to take a look into the eyes with later on. But before we do that, I just want to, as I mentioned earlier, when light hits the pupils, it should accommodate to let less light in, so it should constrict. So I'm going to place my hand onto your nose bridge, if that's okay with you. Alright, and what I'm doing is I'm testing for direct reaction. Alright, we got the constriction, and I'm also going to look for what is called consensual. So it should be symmetrical. When one eye constricts, the other should constrict. So I'm testing both of them. And in this case, I saw both direct and consensual react to light, or what we call perla. Pupils are equally dilated and reactive to light. So the same thing, just keep your eyes towards me. Alright, and I'm going to shine a light. It constricts direct and consensual to the other side. It also constricts. Perfect. Thank you so much for letting me shine a light into your eyes. Okay, so before we take a look further into the back of the eyes, we can do a simple reading test with a Snellen chart. Okay, so you mentioned earlier to me that needs to be a certain distance, which it says here somewhere 15, usually. Used to have instructions here. 15 inches, or?
Let me see. Yeah, 15 inches. So from
Okay.
the tip of the nose to the base of the chart.
Perfect. So it should. So we can get rid of this, right? So it doesn't obscure your vision. Okay. So what we're gonna do is first I ask you to read them with both, and I also ask the patient if they're wearing any corrective lenses, such as contact lens we may not be aware of. In this case, Angelica's not. So if you could read it with both eyes first.
I think usually you test
one eye first.
Yeah.
Okay.
Yeah.
One eye, then both eyes after.
Yeah, from left to right, and then you switch to the other eye, and then you have to do the opposite direction.
Oh, okay.
Reading
Okay.
the smallest line that you can read.
Is this first from the top to bottom and the bottom to top?
Usually the patient selects which line they can read clearly,
Okay.
and then that's how you figure out what the scale is for the vision.
Okay. Okay. Sure. So why don't we do that? Yeah. So if you could cover one eye, so it's up to you.
Okay.
So you're covering your right eye, and you can select which line you can see the most.
Okay. 4, 2, 6, 7, 3, 9. So that's the bottom line. 4, 2, 6, 7, 3, 9.
Even I can't see that, so that's really good. And on the other side.
So I have to read from right to left.
The opposite way.
Yeah.
Yeah.
9, 3, 7, 6, 2, 4.
Okay, which is the same
Yeah,
line.
it's the same line.
So in that case, it indicates that you have 20/20 vision, which means you could see in 20 meters what you're supposed to see in 20 meters, like a normal, healthy eye can see in
Yes,
20.
exactly.
And that's what that reading would mean. I have I think, like my grade is into the 400s, so like I have to move 400 meters closer than what a person with 20 meters can.
Oh, wow.
So that's why I can't see even.
Is it this line? Because it says 400 there.
Well, when I did my test, I couldn't even read the top line, so it's just a little secret. So anyway, that's why I wear corrective lenses.
Thanks for sharing that with me.
Yeah, it's interesting because I started wearing glasses when I was in grade 7. And that's when Harry Potter came out, so I got these Harry Potter glasses, and I thought it was cool until I went to school and I got made fun of. So yeah, it's just my little story. Eventually I would like to have it treated with laser so that I don't have to worry about replacing my glasses all the time because I break them. So yeah. So that's a little fun story about my vision concerns.
Yeah, I mean, if you have glasses that look like Harry Potter, so that's part of the cool club I would put in my books.
Yeah, so fun fact is I'm at the same age as Daniel Radcliffe.
Yeah.
So when the Harry Potter movies came out, I was the same age. So I was literally like living vicariously through Daniel's Harry Potter journey. So it was kind of, that's why I got the glasses. I'm such a nerd. But yeah.
That's pretty cool.
Yeah, so alright, so why don't we go ahead and take a look into the back of the eyes, okay? So in the back of the eyes we can see the macula, the fovea, blood vessels, the cup and disc, which is going to indicate some information, and I'll explain to you as we go over. Okay, so it could be uncomfortable to have a light shine on you, and that's a normal finding, but if at any point it becomes excruciating, please let me know so we can stop the exam.
Okay.
Normally we would dim the lights. It's already pretty dim in this room, so I think your pupils are dilated enough, and we don't require any dilating agents in the basic exam like this. If you were to go to see your eye doctor, ophthalmologist, they may dilate your eyes, but in this case, standard procedure, we don't need to do that. Okay? Alright, so what I'm going to do is I'm going to look with my opposite eye. So if I'm, or the same eye, so if I'm looking at your right eye, I'm looking at with my right eye. And that's to prevent us having, you know, accidentally kissing one another, essentially. So that way my face is outwards. Okay, so I'm going to approach it from a 45-degree angle. Okay, and what we're usually going to see is what is called a red light reflex. So when we look into the, oh yeah, there we go, into the diopter here, we will see the red light flash from a 45-degree angle. That's the red light reflex which is available to us. So is it okay if I place one hand just onto the brow ridge area here just to stabilize? Okay, and then with my ophthalmoscope, I'm going to go in and face that. So if you can keep your gaze towards the front, probably where my ears would be. Okay. And then that
which ear?
So I'm headed this way,
this
ear. So that way I can keep that window open.
Okay.
All right. So I'm just going to go in. Perfect. Okay, good. So from here I can already see some vessels. Okay, I'm tracing the vessels to their origin, which is the cup and disc. Alright, it's difficult to see, but there it is. I'm looking at the ratio of the cup to disc. So in certain instances, when I'm tracing the vessels to the cup to disc, in certain conditions where there's increased pressure into the eyes, such as in glaucoma, we will see an increased cup to disc. Are you doing okay so far? And I'm also looking for the vessels here. They're nice and healthy and plump, without any nicking, which we sometimes see with micro damage to the nerves, such as in diabetes. Looking for the fovea, which is where we see our clearest vision, and then the macula, not too far away from it. Okay, and yeah, so I was looking for nicking, corneal spots. Also good to ask patients if they see any floaters around the eye, things that are in the vision. Have you ever experienced that?
No.
Any narrowing of vision?
No.
Blurry vision?
No.
Dizziness? Okay. Those are important indicators. So yeah, so your eyes appear healthy in the right eye, and then I'm going to do the same thing on the left eye. So same idea here. I'm going to stabilize the patient's head. I'm now going to look with my left eye, which is a little bit trickier for me because I'm not so dexterous here. And I'm going to approach, oopsies, here we go. I'm going to shine it, oh, there's the red light reflex, and we can go in. Okay, and if you can keep your gaze directly towards the light. It's going to come out again because I lost it. I think I was staring into your forehead at some point. I was like, everything is beige. Alright, so again, as I said, my dexterity with the left side is not so accurate. There it is. Okay. I found it. Okay, if you can keep your gaze towards my forehead area, not towards over here. Okay, perfect. Look at the vessels. Same idea here. Alright, so the vessels, the cup to disc, and any nicking is not visible in this eye as well. Okay. Did I miss anything in that exam? feel like there's so much more to look for.
So, mentioning the ratio between the cup and disc, like it should be smaller than 0.3, something like that. Like the
Okay.
disc should be, or the cup should be less than 1/3 of the the cup and the disc. Yeah, it should be like less than 1/3 between when you compare the sizes between the two. And in order to see the macula and the fovea, you have to ask your patient to stare into the light
Okay.
very temporarily. And then, so when you see you'll see the macula, which is like a brighter spot, and then the fovea will be in the middle, and it's like almost like a black pinpoint.
Okay.
Yeah.
I see. Yeah, which is really difficult to see in such a
Yeah.
small window.
Yeah.
But, you know, we try. So that's what they mean by 2-to-1 ratio, which is
Or
this.
3-to-1 ratio.
3-to-1. Okay.
Yeah.
Okay.
Yeah.
Okay, thanks for
Yeah.
correcting that.
And so if the ratios are big, then that could mean there's papilledema,
Right.
and that might indicate glaucoma.
I see. You have a bigger tool than this. I think
do.
I've seen in your video with Samita,
Yeah.
you have a telescope.
Yeah.
So that allows a greater visualization.
Yes.
Also, if, you know, we have the ability to dilate the eyes, then that would help as well.
Mm.
But yeah, well, in this case, yeah, we tried our best.
I think you covered everything though.
Yeah, and I think when we do see, and I've seen it in certain patients of mine who have diabetes, chronic long-term diabetes, you can actually see the damage into their vessels, which are really cool. Yours are really, they're large, larger than what I normally see. So it's kind of,
Really?
it's an interesting, it's almost like
Difference.
rivers running.
Yeah.
Like if you look into a map and you see the rivers,
Yeah.
it's kind of like that. So it's a very cool, it's very red as well, so it's nice.
Yeah.
Yeah.
So like the bigger ones would be the veins, and then the smaller, thinner ones would be the arteries.
Right. Yeah. It's very cool. So, I've had a previous video where I did a point of view, and I've put the images of what they would see, what you would see, into the eyes onto that video, so I can link that into the description, so you can get a chance to see what I see with this cool tool. I think one thing we left out is the confrontation test, and it's not like having a confrontation like a fight, but it's called that because I think we're facing one another, and this was really tricky for me, so thank you so much for enlightening me on how it's actually supposed to be done.
Yeah.
So from what you taught me, okay, so we both have to cover the opposing eye. So if you're covering your right eye, I'm covering my left eye.
Yeah.
Okay?
Or like mirror images.
Exactly. Okay, so if you're able to do that as well with me, and then I'm going to approach. So first I'm going to instruct the patient not to move their head, to keep their eyes towards me, and to let me know when they see the two fingers wriggling in their line of vision. Okay, so that's what we're going to do. So covering your right and covering my left, and we're going to approach from this the real clock position here. So staring into my eye, let me know when you see it.
I see it.
Okay, and that's also when I see it. So coming from up at 1 o'clock, coming down, let me know when you see it. Okay, and from 5 o'clock coming down, let me know when you see it. Okay, perfect. And then I'm going to just switch my hands. You're going to keep your hand where you are. We're going to test the opposite direction here. So let me know when you see it. From 9 o'clock down, it's a bit tricky here. There it is. Okay. And then from 11 o'clock, we're going to come down.
I see it.
I still don't, so something's wrong with my eye. 7 o'clock. Okay. Maybe I'm not doing it correctly. Here we go.
Yeah.
Okay, here. I see it here.
Yeah.
Perfect. Okay, so basically we're testing the periphery of the vision, which in this case, it was within normal findings.
You forgot the other eye.
Oh, sorry, the other eye.
Yeah.
Perfect. Thanks Thanks for letting me know.
Yeah.
That's important.
Yes.
Okay, great.
So we tested, I covered this eye, so we tested my left eye, and now we have to just switch.
Okay, yeah, because we have two eyes. We're not like a cyclops. So, okay, perfect. So same idea here, coming at 9 o'clock and moving in.
Yeah.
Okay,
Yeah.
here.
Mhm.
And at 11 o'clock.
Yeah.
Yeah, okay. And over.
Yep.
Okay, perfect. And you're going to keep your hand there. I'm going to cover this eye.
Yes.
Okay, coming at 3 o'clock.
Right.
Maybe I didn't do that correctly. Let me try again.
Yep.
Okay. I'm covering my eyes incorrectly. I'm only covering it halfway. That's why. Let's try that again. There we go.
Mm-hmm.
Okay.
Yep.
Okay. It's always trickier than the other.
Yeah.
Okay, perfect. Thanks for letting me know. Otherwise, I would have missed one of your eyes. Perfect.
Okay.
So I think that concludes the eye exams.
Mm-hmm.
And from here, it's always good to ask the patient if they have any questions regarding the findings.
No
Okay.
questions.
Good. So if we have found something that is out of what we expect, then we can do further testing.
Mm-hmm.
Usually it would require a referral to an eye doctor,
Mm-hmm.
and they can take a better look
Mm-hmm.
through imaging and such.
Okay.
Okay, so that moves us next to the next E, which is the ear examination.